Welcome to UWM's Employee COVID-19 Training. This training is also available with audio recording. There is a link in the YouTube summary of this video. As an employee at UWM, you are part of a community that cares for and takes care of each other, especially during this unprecedented time. It is our community's mission to keep each other safe, which means that we all must take responsibility and actions to protect our fellow employees. Your health and safety is our top priority. This training will provide you with basic information on UWM policies and procedures, what COVID-19 is, how it spreads, COVID-19 symptoms and when to seek emergency medical attention, how to protect yourself and others, and mental health and well-being resources. Throughout this training, we will reference additional resources that can be found in this video's YouTube summary, including a direct link to the UWM COVID-19 website, uwm.edu/coronavirus. In order to keep each other healthy and safe, all UWM employees are expected to comply with UWM policies, protocols, and guidelines. Employees are required to complete this training, review the UWM Onsite work practices linked in the YouTube summary, and attest to understanding the policies and practices. It's also important that you talk with your supervisor about safety precautions, procedures, and expectations that are implemented in your specific working environment. So, what is COVID-19? Coronavirus disease 2019, also known as COVID-19, is an illness caused by a virus that can spread from person to person. The virus that causes COVID-19 is a new strain of coronavirus that has spread throughout the world. Symptoms can range from mild to severe, and people can carry and transmit the virus without showing any symptoms. COVID-19 is mainly transmitted from person to person. It's spread by respiratory droplets when an infected person coughs, sneezes, or talks, and it's most likely to spread when people are in close contact, which means being within 6 feet of each other for a cumulative total of 15 minutes over 24 hours. Remember, COVID-19 may also be spread by people who are not showing symptoms, and it may be possible to get COVID-19 by touching a contaminated surface or object and then touching your mouth, nose, or eyes. But this is not thought to be the main way the virus spreads. According to the Centers for Disease Control and Prevention, or CDC, COVID-19 has a wide range of symptoms. Symptoms can include a fever of 100.4 degrees or higher, or chills, a cough, shortness of breath, or difficulty breathing, muscle or body aches, fatigue, headache, new loss of taste or smell, a sore throat, congestion or runny nose, nausea, vomiting, or diarrhea. And this list may not include all possible symptoms. The YouTube summary of this video includes a direct link to the CDC for more information. If someone is showing any of the following symptoms, they should seek emergency medical care immediately. Trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, or bluish lips or face. A vaccine under emergency authorization is being rolled out. Updates on availability will come through state and local public health authorities. The best way to protect yourself is to avoid being exposed to the virus that causes COVID-19. To protect yourself and others, follow the UWM on-site employee work practices. They include the following, which we will discuss in more detail in this training. Self-monitoring for symptoms each day. Staying home if you have symptoms, if you tested positive for COVID-19, or if you've had close contact within the past 14 days with someone who tested positive for COVID-19. Practicing good personal hygiene. Practicing social distancing, both at work and outside of work. Wearing cloth face coverings, both at work and outside of work, whenever you are around others who do not live in your household. And making sure to routinely disinfect surfaces in common areas and shared workspaces. A link to the UWM on-site employee best practices is available in the YouTube summary of this video. Daily symptom monitoring helps detect the early onset of illness so employees can self-isolate and reduce their risk of spreading the disease to others. This is why employees must self-monitor for symptoms before coming to work. The YouTube summary of this video includes a direct link to the UWM COVID-19 Symptom Monitor. And you must stay home if you've had symptoms consistent with COVID-19, you have tested positive for COVID-19, or you have been identified as a close contact of someone who tested positive for COVID-19, or a medical provider determined that person has a clinically compatible illness. In any of these situations, you should contact your medical provider and notify your supervisor. When you contact your supervisor, be prepared to inform them of any close contacts you have interacted with, as well as the locations that you have been on campus in the prior 48 hours. Update your supervisor of your condition periodically so they can provide guidance on when you can return to work. You must stay home until your supervisor gives you approval to return to work. Supervisors, human resources business partners, or deans or their designees shall complete the UWM Employee COVID-19 Case Management Submission Form. If preferred, the employee may self-report using the same form. Employees may return to work after the designated isolation or quarantine periods. Follow the reporting and return to work procedures in the on-site employee work practices document. Practicing good personal hygiene is very important to reducing the spread of COVID-19. Wash your hands often. Use soap and warm water, washing for 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. Use hand sanitizer with at least 60% alcohol if hand washing facilities are not available. This video from the CDC answers important questions about hand washing and hand sanitizer. It's also important to avoid touching your eyes, nose, and mouth with unclean hands. Always cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. Then throw used tissues in the trash. Immediately wash your hands with soap and water. If soap and water are not readily available, clean your hands with hand sanitizer, covering all surfaces of your hands and rubbing them together until they feel dry. Always practice social distancing, which means staying 6 feet away from others. And remember, a cloth face covering does not replace the need for social distancing. To protect both the campus and the surrounding communities, non-surgical face coverings, such as cloth face coverings or disposable procedure masks, must be used and social distancing observed by all students, employees, and visitors while at UWM. This includes the branch campuses in Waukesha and Washington County. Face coverings with exhalation valves are not allowed. Limited exceptions to the UWM face covering policy are subject to approval by an employee supervisor and/or human resources. A link to the UWM face covering policy is available in the YouTube summary of this video. UWM's face covering policy states you must wear a face covering when you are outside of a building when and where social distancing is difficult to maintain. and face coverings are always required inside of UWM buildings with limited exceptions. Remember, a face covering does not replace the need to practice social distancing whenever possible. This short video from the CDC provides key information on when to wear a mask, including at home. And this short video from the CDC demonstrates the correct way to wear a face covering. Wearing your face covering can protect others in case you're infected with COVID-19 but don't have symptoms. You should always wear it in public settings when you're around people who don't live in your household. And remember, don't touch the face covering, and if you do, wash your hands or use hand sanitizer to disinfect. It's also important to take off your face covering correctly. Start by untying the strings behind your head or stretching the ear loops. Then handle your mask only by the strings or ear loops. Fold the outside corners together and place the face covering in an unsealed bag. Be careful not to touch your eyes, nose, or mouth when removing the face covering, and wash your hands immediately after removing it. In addition, you should use a clean face covering each day. Cloth face coverings should be laundered daily, and disposable procedure masks should be discarded in the trash after use. Launder cloth face coverings with regular clothing detergent and the warmest appropriate water setting for the cloth used to make the face covering. To dry, use the dryer's highest heat setting or air dry in the sun if possible. Cloth face coverings should be replaced immediately if soiled, ripped, punctured, or visibly contaminated. At UWM, Environmental and Custodial Services will perform normal cleaning and disinfection procedures with added emphasis on frequently disinfecting high-touch surfaces such as door handles, handrails, and elevator buttons. Other focused cleaning will also be performed in common building areas. Employees are responsible for routine cleaning and disinfection of their personal work areas as well as shared workspaces. Employees are also advised to clean and then disinfect shared surfaces and equipment before and after use. If surfaces are soiled, they must be cleaned with soap and water before using a disinfectant. You should always make sure cleaners and disinfectants are compatible with the surface you are cleaning. Check the disinfectant label or equipment manufacturer information to ensure the disinfectant is safe for equipment such as touchscreens, keyboards, and computers. Please read and follow all safety precautions and directions on the label to ensure safe and proper use of the product. You should also minimize contact with common touch points. If possible, use your shoulder, elbow, or hip to gently open unlocked doors instead of using your hands. After washing your hands, use a paper towel or your elbow to turn off the faucet, and do not touch your eyes, nose, or mouth with unclean hands. Along with your face covering, other personal protective equipment, or PPE, may be required to safely do your job. Healthcare workers, police, and environmental and custodial services staff will need PPE to prevent exposure in certain circumstances. Gloves are not necessary for general use and do not replace good hand hygiene. Washing your hands often is considered the best practice for common everyday tasks. Staff do not need to wear additional eye or face protection like safety glasses, goggles, or face shields as part of general activity on campus. Good hand hygiene and avoiding touching your face are generally sufficient for non-healthcare environments. Respiratory protection is also not necessary for general campus activity. PPE and supplies are being purchased at a central level and will be distributed to campus departments as needed to maintain essential operations. Individual departments will not be charged at least through spring 2021. Managers should submit a single PPE request form on behalf of their entire department. The PPE request form is available at uwm.edu/PPE. A direct link to this form is available in the video's YouTube summary. In addition to the UWM on-site employee work practices, there are additional safety measures that UWM will utilize. Employees may be asked to work remotely or adjust work schedules to accommodate social distancing. Offices, classrooms, meeting rooms, and common areas will be reconfigured for proper social distancing. Virtual meetings are an expectation whenever possible. Plexiglass partitions will be located at many points of service, such as reception desks. Signage will be posted throughout buildings to remind employees of proper preventive measures, and hand sanitizer and disinfectants will be made available throughout buildings in office areas, classrooms, meeting rooms, and common areas. More information is available on UWM's COVID-19 website. There's a direct link in this video's YouTube summary. And remember, mental and emotional well-being is an important part of staying healthy in times like these. UWM is committed to supporting your overall health. We encourage you to work with your supervisor and other resources in your care network. UWM offers an employee assistance program through KeyPro. The Employee Assistance Program is available to employees and members of their household. KeyPro offers confidential resources to address personal and work-related concerns. More information is available at uwm.edu/hr/EAP. There is a direct link to this site in the YouTube summary of this video. Thank you for taking the time to complete this course. If you have follow-up questions regarding COVID-19 and safety in the workplace, please reach out to your supervisor. We have also provided links to many additional resources in the YouTube summary of this video. As our knowledge and understanding of the COVID-19 virus continues to evolve, policies and plans will be updated. By practicing the preventive measures covered in this training, you will help to protect yourself, your fellow Panthers, and the surrounding community. Please return to the attestation form and check the box to indicate you have completed the training.